All right, we left you with the question before we went to break. What do we use on a daily basis that could be unhealthy and germ-infested, audience? And we stick it in our mouths. Toothbrushes. Yes, it's your toothbrush. It could harbor more than 100 million bacteria, including E. coli and staph. Here to show us how to avoid that dirty situation, please welcome back cosmetic dentist Dr. Terry Alani. Hello. Okay, and she is in her fatigues because she is the drill sergeant of mouth and tooth education. In fact, you have your little shirt on that says...
Yes, I do. It's Dr. Terry Alani's Tooth Academy.
There you go.
So,
all right. Yes, we have some music for you, too. Okay, so 100 million bacteria. Yeah, because I want to be honest, how many of you, after you brush your teeth, you may run it under a little bit of water and then you put it back up, right? Okay, I stick mine in alcohol every now and then.
Well, you know, it's interesting. Don't fear, because our mouths aren't exactly sterile either. And so we have hundreds of microorganisms in our mouth. And basically the reason we don't get sick is because there's usually a healthy balance between the bacteria and what we have on our toothbrush. And just remember, bacteria is in our plaque. Plaque is bacteria. So every time you're brushing your teeth, you're actually putting bacteria on your toothbrush. That's why it's so important to brush your teeth very often.
You know, it's kind of funny because a lot of us, if you said you had all this bacteria in your toothbrush, people go, ooh, but they don't floss, and that's bacteria in between your teeth.
Exactly. When I read that, 100 million bacteria, that caught my attention.
Yeah.
Yes.
All right. And just the fact that for most of us, our toothbrush may be in the bathroom, and so that area alone, there's simple things that we might not be thinking about. For example, when you have your toothbrush out and you flush your toilet.
Right. Do not put your toothbrush next to your toilet. Now, there are some bathrooms that are smaller, so a lot of people will put it in a little holder close to the toilet. Every time you flush the toilet, you're getting a spray of bacteria that goes on your toothbrush. And what I tell patients is, first of all, you don't put your dishes or your silverware next to your toilet.
Yeah.
And the other thing is, make sure you wash your hands before you brush your teeth. Just like you wash your hands after you use the restroom, wash your hands before you brush your teeth.
All right. Keep it rinsed. Just some of the simple things.
Some of the good ideas of storing it is, number one, keep it rinsed. Make sure you rinse it between brushings. Number two, store it upright. Number three, make sure that you keep it dry, because bacteria thrive in a moist environment. So you don't want to do those toothbrush covers.
Yeah.
And the other thing is, do not put it in a holder with other toothbrushes, because it can swap. You can swap germs.
Yeah, and sharing toothbrushes.
Forget it. That is not going to happen. And you know, if your spouse or significant other has gum disease and you share the toothbrush, that bacteria is going into your mouth also.
And a more serious issue, there was a show that we had done years ago on hepatitis C, and there was a man who was in the hospital with his father before they really knew what he had, and he was staying overnight in his dad's room and needed to brush his teeth and just grabbed his dad's toothbrush. Well, because there was a little bit of blood on it and which microscopic, you couldn't see, they figured that that's how the son actually got the hep C as well. So sharing a toothbrush, don't do. Okay, there's lots of sanitizers, we know, like for toothbrushes, the UV sanitizers and all those things. Do those really work?
Okay, you know, you've read a lot about the UV sanitizers, and basically they kill about 99% of bacteria. But if you have 1 million bacteria on your toothbrush and you use a sanitizer, you're still going to have 1,000 bacteria left. So yes, they work, but the safest way is to use common sense and just dispose of it about every 3 or 4 months. You want to dispose of it if you've been sick. If you've had a disease or whatever and you've had the flu, get rid of your toothbrush. You want to get rid of your toothbrush if the bristles are frayed. A lot of times, I mean, I know my son came home from college and I saw his toothbrush and it looked like it had been through the ringer. Also, you want to get rid of your toothbrush if, you know, about every 3 to 4 months.
Yeah.
And another piece of advice that I get asked a lot, do not put your toothbrush in the microwave or the dishwasher. Yes, it will be clean, but you will not have a toothbrush when it comes out.
Yeah, because those bristles can come out of there as well.
Exactly, yes.
All right, and while we're on the topic of toothbrush, I know a lot of us think that like a soft bristle brush we're thinking is way too soft, and we think if we get a hard bristle brush, we're getting those germs.
Exactly. A soft brush is the way to go. Soft bristled brush. And you want to buy a brush. There's a lot of factors involved. The late 1930s is when nylon bristles were first invented. I bet a lot of people don't know that.
Yeah.
And at that time, it was easy. We didn't have a lot of choices. You went and bought one brush, that was it. Now, there's a whole aisle devoted to toothbrushes, and it's very confusing. So you want to make sure you buy one that's ADA approved, which is American Dental Association, because they test. They make sure that the bristles are not going to come out, that they're going to last, that the handle is long enough that you can maneuver. You want to buy a toothbrush that is, the bristles are like a ½ inch wide and 1 inch tall. And you want to buy soft, because you can do damage to your teeth if you brush really hard. If you brush with a hard or a medium toothbrush, you actually can take away enamel and you can cause gum recession. A lot of people are very, very heavy
because we think
brush.
we're getting the germs.
Exactly.
And then quickly, before we get to a special that you have, with kids, better to get an electric toothbrush, because I just know it. He'll like do this real quick, but if he has an electric one, it can do part of the work for him.
Okay, there's a lot of controversy between electric and manual toothbrushes. If you have arthritis, you might want to go, which has nothing to do with kids, but you might want to go with an electric toothbrush. They've done studies of manual versus electric toothbrushes, and they found that the only advantage would be something like the Sonicare, where you have an oscillating head, which means it goes back and forth and up and down. If you have a child, number one, you want to have make sure you get a child's toothbrush with soft bristles. Take your child with you if they're old enough, because if they like their toothbrush, they're going to brush. And make sure it's ADA approved.
SpongeBob SquarePants toothbrush. Okay. All right, Terry, you have a special on something that's just been crazy successful, because it's called Snap-on Smile. And it's one of those things where you can literally snap on. These teeth are snapped on, and they look like real teeth.
It's an appliance.
Yeah. And you go in and get your mouth fitted for it and the whole bit. And great for people who either can't afford at this time to get veneers or something like that, and it can just completely change their smile in a snap.
Exactly. We have done so many. We did it last segment, and I think we saw 150 patients.
Wow.
And it's pretty amazing, because what it does, it allows you to have beautiful teeth without spending a fortune. And it's only been out a couple of years, but it is fascinating. I love doing them.
Dr. Lonnie's special offer for Great Day viewers on Snap-on Smile from now until Fridays, just from now until Friday, get $200 off the Snap-on Smile when you mention Great Day Houston. Now, they don't have to get it by Friday, but they make an appointment.
Just make an appointment.
Make an appointment. So to take advantage of this special, call Dr. Lonnie's office at 713-621-5141, 713-621-5141, or find her on the web at texastoothlady.com. Also, Dr. Lonnie co-hosts a radio show with her brother, orthopedic surgeon Dr. Wayne Alani, every Tuesday at 1 p.m. on CNN 650. And it's called For Your Health with Terry and Wayne, so be sure to check that out as well. And on that Snap-on Smile, it can be whether you have severely damaged teeth, slightly crooked teeth, or if you just don't like your teeth.
Exactly.
All right.
For everyone.
Thank
you. You're welcome.
Up next.